Hi, my name is Caitlin. I'm going to be your student nurse today.
Okay.
I'm going to be with you for about 10 to 15 minutes. I'm just going to be doing a physical exam on you. Do you have any questions for me?
No.
Okay. Well, I just wanted to thank you in advance for letting me perform this on you. All right.
Okay.
So I'm just assessing my patient. She seems to have good posture. She has a good positioning. She's sitting upright. She doesn't have any issues there. She seems to have a good mood. She doesn't have any unnatural or abnormal behavior. She's having conversation with me, and she seems to be lighthearted. All right, and then I'm also noticing that she has good hygiene. She seems to keep herself clean. She's wearing clean clothes. She's dressing correctly for the season. Not noticing an issue there. And then, are you in any pain today?
No.
Okay, perfect. And then I'm also not noticing any lines, tubes, or draining. So to start off, I'm just going to do a quick assessment of your scalp real quick. Is that okay?
Yeah.
Okay.
Yeah.
So I'm going to run my hands through your hair. I'll try to keep your part for you. Right. I'm not noticing any bumps. And then I didn't see any lesions. I'm not noticing any abnormal hair growth, like no splotchy patches. I'm now going to check your eyes. So I'm just going to shine the light in your eyes. You can just look at me. Perfect. I'm going to do the other eye real quick. Right. And you only wear glasses, correct?
Correct, yeah.
Okay. So I noticed that your pupils were round and equal. They were reactive to the light, and they were accommodating to the constructed with the light when I shine the light on them. And then now I'm just going to check your ears.
Okay.
Just 2 piercings I see?
Yes.
Okay. Perfect. I'm not noticing any issues with that. Yep, no drainage out of the ear piercing sites or the ears themselves. And then I assume that you've been able to hear everything I'm saying.
Mm-hmm.
Okay.
Yeah.
I could also tell because you're responding to my questions and everything. Now I'm going to check your nose real quick. So I'm just going to have you look up for me. Perfect. Not noticing an issue there. And no drainage. I didn't see anything wrong with the septums. Then I'm also just going to have you close one nostril and breathe out for me. And then I'm going to have you do the other nostril as well, please. Perfect. I didn't notice any congestion, which is impressive for the season right now. All right, and then I'm going to have you open your mouth for me.
Okay.
All right. I noticed that the mucosa was nice and dry. I didn't notice, nice and wet. There was no issues there. And I noticed that you have good dentition. I didn't see any cavities while I was looking. And then I am just going to assess your eyes real quick one more time. I'm not noticing any drainage from your eyes as well. No abrasions. And then could you pull your eyelids down for me, please? Okay, perfect. Your conjunctiva is nice and pink. It's nice and moist. I think we're good there. And then I'm just going to test your neuro today as well. Do you know what today's date is?
April 11th.
Okay, perfect. Do you know who the president is?
Trump.
Okay, and do you know where you are?
At the doctor's office, aka my house.
Okay, perfect. Very fancy one. All right, and then I'm noticing as you're smiling, I'm not noticing a drooping of the sides of the mouth or just one side of the face, so hopefully no stroke there. And then I'm also just going to test your strength real quick, so I'm going to put my hands out. I'm going to have you pull me towards you. Okay, and push me out, please. Thank you. Then I'm going to rest my hands on your shoulders. I'm just going to have you lift your shoulders up. Perfect. And then if you could you put your feet out in front of me a little bit? Perfect. I'm going to have you pull your toes to your nose and then push on the gas pedals. Perfect. Got that. All of the strength was intact there. Right. And then I am going to go ahead and test your sensory as well. So I'm going to tap my pen light on a different part of your body, and I'm just going to have you tell me what side and what part of the body it is, okay?
Okay.
So I'm going to have you close your eyes for me.
My right arm, left leg, left arm, right leg.
Right, and then I'm going to use my finger for this. Sorry. Your forehead.
My forehead.
Okay. Close your eyes.
Okay. My left cheek. My right cheek. My nose.
Perfect. I didn't notice any issues with your sensory as well. And then your speech has been clear. You've been able to talk to me the whole time. Although there's been a little lapse, but that's okay. All right, and then now I'm just going to check your cardio real quick. So I'm going to have you hold out your hands for me. And I'm just going to press on your fingernails.
Okay.
That's checking the cap refill. It was less than 3 seconds. That's what we're looking for.
Okay.
And I'm also going to have you put your feet out real quick. And I'm just going to 3 seconds on that as well. Looking good. Right. And then now I'm going to assess your pulses. So I'm going to have you put your arms out. I feel your radials first. All right, so those are equal. Now I'm going to move up the arm. Just going to do the brachials. All right, still equal. And then I am going to have you pull your feet out one more time, please. All right, I'm just going to feel. Ooh, maybe shift your feet a little bit more.
Or here.
Okay. And I'll just feel these veins right here. All right, and then those were equal as well. All right, and then now I'm going to listen to the different heart sounds. So I'm going to put my stethoscope on. I'm going to start here. Move to the side. Down. Last spot. Perfect. I didn't notice any extra heart sounds, any murmurs, nothing there. I didn't hear anything like that. All right, and then I'm going to check your jugular vein real quick. So I'm going to have you look that way for me. Perfect. And I'm going to have you stretch your head and look the other way now. Thank you. I didn't notice any distension there. And then now I'm going to assess your carotid. So I'm just going to place my fingers on this side first. Perfect. Strong pulse there. Strong pulse there as well. And then I'm also just going to listen as well, because there are some sounds that we can hear. I'm just going to make sure you don't have them. Ooh, sorry, she's being... Perfect. I didn't hear any whooshes or bruits in there, which is what we want to hear. Right, and then now I'm going to do a respiratory assessment on you as well. I've noticed her respiratory rate is between 12 and 20. She's having an equal work of breathing. She's not having any concaving or barrel chest. I have also noticed that she has also had a symmetric raising and lowering of the chest. Right, so now I am going to listen to your lungs real quick. All right, so I'm going to place the stethoscope on your skin, and when you do, I'm just going to have you take a deep breath in and out. Perfect. And then I'm going to have you lift your arm for me, and I'm going to do it on the side as well. Perfect. You can put your arm down, and I'm going to go ahead and do it on the back as well. I'm going to have you turn that way a little bit. Thank you. So I'm going to do one over here. Oh, I'll remove your hair. Perfect. All right, you can go ahead and move back to the positioning you were in. Again, I didn't hear any issues. I didn't hear any whooshes or any stridor, any sounds that I wasn't supposed to hear. Again, it sounded unlabored. Didn't hear any issues. And then now I'm going to do an abdomen assessment. So I was just curious, when was the last time you had a bowel movement?
Like 2 hours ago.
Okay. And how frequent do you have those a day?
A couple times a day.
Okay. And then how about urinating? How many times a day do you urinate?
A lot more, like 10 probably.
Okay. that's normal.
Okay.
And then when was the last time you urinated?
Right before my
Exam?
Exam.
Okay, perfect. All right. I'm also just noticing that the shape and contour of her stomach is pretty even. It's consistent with her body, and I'm not noticing any distensions. I'm going to go ahead and have you lay on your back, and I'm going to listen to your bowels and then also press on them. And you're not feeling any pain in there, correct?
Nope.
Okay, good. So I'm going to start by listening. Maybe. Okay. The sounds were a little hypoactive, but since you had one earlier, that's kind of normal. So then I'm now just going to press on your stomach. Just let me know if you feel anything or if it hurts. Okay. All good?
Mm-hmm.
Okay.
Yep.
Perfect. You can go ahead and sit up now. All right. It was non-tender, non-rigid. I wasn't feeling any hardened nodules or anything. Client states she didn't feel any pain, so that is already a good sign. So now I'm going to test your musculoskeletal system. So I'm going to test your range of motion first.
Okay.
So I'm going to stand behind you, and I'm going to have you raise your arms above your head. Okay, I'm going to have you put them out to the sides. Whoop, a little pop. And then down to your sides. And raise them out in front of you, please. Thank you. Perfect. And then now I'm going to have you look over to the right for me. Oh, thank you. Look to the left. Then I'm going to have you look up and down. Perfect. And then I am going to have you straighten your legs now. And bend them, please. Perfect. I didn't feel any crepitus, which is just kind of like creaking. It felt like it should. There was a little bit of tenderness in the shoulders with the pops, but that's all normal. All right, and then now I'm going to assess your gait. So I'm just going to have you stand up. I'm going to have you walk to that corner. Perfect, right there. And then I'm going to have you turn, and I'm going to have you do heel to toe for me.
Okay.
Perfect. All good. And then I'm going to have you sit back down. I didn't notice any issues with your balance. You seem to be pretty good, well coordinated. The last thing I'm going to assess is your skin. I didn't notice anything wrong with it. I was assessing it throughout our assessment. I noticed that it was pretty dry. It was pretty warm, which is where we want it to be, not like cool or warm or hot, just right in between. I noticed that her skin is kind of palish pinkish. She does have some macules and papules throughout the skin, but none for concern. And then I am just going to have you give me your hand real quick up, if you could.
Yep.
Thank you. Just going to lift up the skin. Good skin to her. No issues there. I think that completes our assessment. Did you have any questions for me?
No.
Okay. Well, I'm going to send the doctor in. All right.
Okay. Thank you.
Yep. Hand tight.